As an intensive care registrar, I'm involved in patients that are rapidly deteriorating around the hospital. Many die within minutes or hours without intervention. I'll show you a few of the apps and resources that I have on my phone that help me manage these patients in these situations. The first app is very basic and not fancy at all. It is the timer app. When the emergency page goes off, I start the timer as I'm making my way to the patient. This will be useful if the emergency turns out to be a seizure, where anti-epileptics have to be given if the seizure hasn't been terminated by 5 minutes, or cardiac arrest when I want to keep track of how long CPR has been going on for. Next up is the iResus app. There are useful common emergency algorithms in there. I use it to reference and confirm emergency drug doses, especially those drugs that I do not use on a regular basis. The next app is the EasyIO app. I have placed a few intraosseous needles in my time, but these situations are relatively rare. I like to have this app in case I need a reminder of landmarks, especially if there's a child involved. The next thing is not an app, but notes that I've made in the past during my studies and stored on my phone. In particular, the mnemonic wet flag, which is the mnemonic for the calculation of emergency drug doses, fluid therapy, and weights for children. I have this available within 3 or 4 taps on my home screen. The last resource I'll cover in this video today is a photo of the tracheostomy emergency troubleshooting algorithm. Whilst tracheostomy patients are meant to have the emergency algorithm by the bedside, I like to have this in my phone as a fallback. There are several other apps and resources that I use as an intensive care and renal doctor, and I'll cover more of them in upcoming videos. If you want to learn my rapid 5-step process for assessing someone's airway like a pro, watch this video. I hope that helps.